my intention is to get you more informed about what's going on. There's a lot of information out there. Some of it is misinformation, some of it is good information. But I think it's important for you all to get it straight. So in about 20 minutes, you all will be experts in COVID-19. I can almost guarantee that. So this is an update. I was telling Chief DeCamillo that I've already changed this slide presentation 3 or 4 times already. I gave my first presentation to Sugar Land about a month ago. Everything has changed. I just completely changed all the slides because whatever we were talking about then doesn't even apply now. Even the name has changed. It used to be called 2019 nCoV. Now it's SARS-CoV-2, and it stands for Severe Acute Respiratory Syndrome. It's also known to cause a disease called COVID-19, and that's a name that you're probably more aware of. It's very fatal. It's mostly fatal to our elderly population and people that are having that have immunosuppressive conditions, diabetes, people on dialysis, heart disease, cancer patients on chemotherapy, anything that suppresses the immune system. They're going to be the most vulnerable population. It's here. It's 4 weeks ago we were talking about China. Well, now we're talking about USA, because it is definitely here and it's already spreading in our community. One of the challenges was that when the testing came out, it was delayed because the federal government put out some bad kits. Some of them were contaminated and they had to get them all back and start over again. We lost precious time. I figure we lost about 2 weeks, and that 2 weeks is really, really important. Are we getting ahead of it? I doubt that we are. I don't think that's going to happen. So that's not our focus right now, try to get ahead of it. What I can tell you, it's like a 5-mile race with the virus being about 1 mile from the finish line, and we are about 5 miles from the finish line. It's not good. And the other issues is that right now we have no vaccines, there is no treatment, antibiotics don't work, and the Tamiflu that we use for seasonal influenza does not work. The other challenge is our healthcare system. It's already being overburdened, but it's going to get worse. And the main problem is our ICU beds and ventilator demand. It's definitely exceeding our current supply. Remember that just because the virus is here, that doesn't mean that the other diseases have stopped. Heart disease, strokes, and a lot of these diseases that require ICU care and vents, those diseases are still ongoing. So that presents some ethical issues about who gets to be on a vent and who doesn't. I hope we never have to make that decision in this country like they are making that decision in Italy. I put the red one because this just popped up today. Frontline healthcare workers are now getting hospitalized. We're actually having people like myself getting put in the hospital, in the ICUs and even on ventilators because people like me who are taking care of sick patients are vulnerable. Our first responders, our paramedics, these frontline people, we're at risk for getting the virus. And part of the problem is that we don't have enough of the protective gear. It's not enough to go around. Resources are definitely limited. I hear that it's going to get better, but I haven't seen it. Our best chance is a concept called social distancing, which I'll talk about later. This came out on the 16th, 2 days ago. Our president put out some guidelines and discussed remote work, working if you can work remotely at home or go to school. A lot of the universities now are holding online classes, and I suspect that's going to happen a lot more. The use of drive-thrus, takeouts, deliveries instead of eating at restaurants and bars, avoiding discretionary travel. If you don't have to go someplace, stay home. Avoiding visiting nursing homes. A lot of them are now on lockdown, so you can't go visit them, nor should the nursing home people leave their quarters because they're going into areas unknown. Social gatherings, some people have said limited to 250, others say 100, others say 50, and the White House is saying 10. Some states have restricted, it's been very, very variable. School closures, university closures in areas with known transmission. Of course, you've already heard bars, restaurants, food courts, gyms, outdoor events, indoor events. Any place where there's known community transmission, basically these places should close. And I think that's the current standing in Fort Bend County. The background, I'm not going to turn this into a science lecture, but just a little bit of a background. Coronavirus is a large family. It's been around forever and ever and ever. The coronavirus family is not new to us. There are about 7 types that have known to infect humans. 4 of them cause very mild symptoms like the common cold. But unfortunately, there's been 3 that have jumped to animals. And those are the ones that are causing serious illness. You all remember the SARS, 2002? And then a decade later, we had the MERS, that was in 2012. And now, of course, our SARS-CoV-2. These are the 3 that we're concerned about, and they're following pretty much the same track. All of these are felt to started in the horseshoe bat. I don't know why, but that's the natural wild reservoir for this virus. The problem is that the bats aren't getting humans infected. The bats are going to an intermediate host, and that animal host is what's infecting us. The intermediate host for the SARS-2 is felt to be an animal called pangolin. And they're ugly-looking things. They look like an anteater, but they also look like an armadillo. Yeah, they're not really good to look at. But anyway, and the problem is that these animals are being sold in the live animal markets, mostly in the Wuhan, which is the capital of Hubei province in China. The population of Wuhan is about 11 million. In the case of both the SARS and the SARS-2, these intermediary hosts are sold. They're sold for meat. Now we don't know whether it's the meat that they're eating is getting them sick, or they put these animals in cages and they stack up the cages, and they sit there all day. They poop, they pee, they throw snot. We don't really know exactly how it's being transmitted to the humans, but these areas are very, very unsanitary, very unhygienic. To humans and to the animals. That increases the risk of these viruses recombining and mutating and mutating and mutating until they finally come to us and cause disease. I put the slide there. I don't want to get too involved in this, but you'll see that in all 3 of the SARS, there is an intermediary host. It's not directly from the bat. Timeline. The public health emergency declaration by the World Health Organization occurred January 30th, 2020, and a day later, the U.S. declared the same. Most cases are mild. About 80% will just have very mild symptoms. Some of them are so mild they wouldn't even come to the attention of a doctor. And then you have the 15% that are much, much more severe. They have the pneumonia and the shortness of breath. And then 5% of those people become critically ill. And half of those end up requiring ICU care and ventilators. The elderly, like I pointed out earlier, are most at risk. They have the highest fatality. Men, for some reason, tend to be slightly higher risk than women for reasons unknown to anybody. That may balance out in the end, but right now that's standing. Children are at risk, but are still considered very low. And when they get the disease, it tends to be milder with a much faster recovery. Now, as time goes on and the virus becomes more virulent, that may change. This just goes to show a graph about the elderly and the death rate. If you look at the graph, right about 60 years old, it starts taking off really, really high. So the older people get, the more at risk they are. So on average, symptoms can develop 4 to 6 days from the time of exposure, but the incubation time, this is the time when they were exposed but haven't had any symptoms, can range from 1 to 14 days. Most cases will recover within 2 weeks. There is a blood test out there, and the way the blood test works, it detects the antibodies that develop against the virus. There's only 2 ways that a human body can develop the antibodies. One is to get a vaccine, which is kind of like our flu vaccine. We give somebody a flu shot, and they develop antibodies to fight off the flu whenever it comes. The other way to get it is through direct viral infection, and that's not the most popular way, obviously. Case fatality rate is unknown. I've seen literature about 1% up to 3 to 4%. I think on average, most people agree that the case fatality rate is about 2 to 3%. Compare that to the 10-year average mortality rate for the seasonal flu is 0.1%. So in this country, our seasonal flu will infect a lot of people, 45 million Americans, with about 46,000 deaths. and it's still considered a leading cause of death. So we do lose more people from the influenza infection every year. How does it spread? It's mainly spread through respiratory droplets that are launched from the mouth or the nose due to coughing or sneezing. Once it's airborne, it immediately drops to the ground no more than 3 feet away. But some recent studies have shown that the droplets can be airborne for up to 3 hours. That's not good. So the infected droplets can then spread to people accessing the eyes, the nose, the mouth, and the lungs. It could also be spread by unclean, unwashed hands. The other thing is that this virus can land on a surface and survive for a while. In some studies, it showed that the virus has lived for 9 days on surfaces. The surface seems to be a major player. Steel and plastics, they tend to survive longer in those surfaces, and I'm not sure why that is. This is just a slide to show you what happens when somebody coughs. We don't see it, but it's there. And this stuff can hang in the air for about 3 hours. People that are not sick are not considered the major driver of transmission. People that are sick are, though. So people that are coughing and wheezing and fever and all that, they're the ones that are really transmitting the virus. This is a novel virus. You hear the word novel, that just means it's new. That means it is unknown to human beings. That makes us all susceptible to the virus. People that are getting it are mainly people that are in close contact, such as family members, caretakers of sick people. I get asked a lot about pets. Right now, there's no evidence of pet transmission to humans, and vice versa. So again, the risk of community spread is still low, but I predict that's going to change as time goes on. Disinfectants do work, and there was talk about fecal-oral contamination, but basically, if people just practice good hygiene, clean their bathrooms regularly, this should not be a major problem. The major transmission is through the mouth, through the nose. So prevention, wash your hands frequently, thoroughly, before eating, after using the restroom, sneezing, coughing, blowing the nose. Hand washing and soap, believe it or not, is still considered optimal, not the hand sanitizers that you can't even find anyway. Any soap will do. There's no such thing as an antibacterial, antiviral. Any soap will do. So the recommendation is to turn off the faucet with a towel that you dry your hands with, and then discard the towel. If you're coughing or sneezing, could cover your face with the elbow or use some tissue. If you use tissue paper, make sure that it's discarded and wash your hands. Avoid contact with people that have symptoms. Try to stay at least 6 feet away. That's what we consider pretty safe. If people are sick, they should not be going to work. They should not be going to school. And they should stay home until the symptoms have resolved, usually within 14 days. Routine disinfection. And my personal pet peeve is touching the gasoline pump handles. I have hand sanitizer in my truck just because whenever I'm done pumping gas, I have to clean my hands. I have no clue who touched it before me, nor do you all, nor does anybody. This slide is not showing the whole thing. How do I get it to move up?
She heard you say that.
I'm sorry?
I have no idea.
Okay. Then I'll just say it. So face masks. Face masks are recommended for people that are ill. They're not recommended for people that are not ill. I know that you've seen all these pictures from China and Asia where everybody's running around with masks. Well, that's not really helping anybody. So the recommendation from our CDC is if you're ill, use a mask. If you're not ill, you really do not need one. Masks should be used. The exception is people that are in close contact with a sick family member or caretakers. So the best solution right now, there it is. The best solution right now is social distancing. I'm sure you've heard that concept. Social distancing is not meant to stop the pandemic. It's not going to do that, but it will slow down the surge, mitigate or slow down the surge. And what that's going to do, it's going to buy us time for our healthcare operations to help the people that are really, really sick. What's going to happen is that we're going to have a lot of people that are sick in a very short amount of time, and we will have trouble trying to take care of everybody. So the purpose of social distancing is to slow it down. Slow it down. It's not meant to stop it. You see, this is a theoretical or hypothetical graph that Dr. Anthony Fauci, NIH director, has used. And you'll see that in a situation where no intervention is, there is a very fast surge of cases and people that are dying. So what he is emphasizing is that we should flatten that curve down to attenuate or slow down that surge. This is hypothetical. Now, did it happen in real life? Well, this is the graph from the 1918 pandemic, the Spanish flu. And you'll see that in Philadelphia, which is the darker line, they knew about the Spanish flu, but they did nothing. In fact, they had a citywide parade during all this. Everybody was close together, like Macy's parade. And look what happened. If you look at the other town, I believe that was St. Louis, look what happened. They did practice social distancing. So this confirms that if we can attenuate that surge, it'll be better for the population. It'll be better for our healthcare workers to manage all the sick patients and not be overburdened. Social distancing, we've already gone through this. This is what President Trump in the White House has recommended. I did want to add the last one, which wasn't anything that he recommended, but I think that people should rescheduling non-essential medical testing and doctor visits. So if you're needing an eye exam, I think you can put that off. That's not urgent. So if at all possible, put down or set aside and delay some non-essential medical visits to your doctor. And of course, there's telehealth now. People are practicing medicine through the audiovisual thing, which I think is going to be a big deal for days to come, weeks to come. Well, what happened to the presumptive positive? Well, that's out the door. CDC is no longer doing confirmation testing. So if our local public health and state labs are calling something positive, it's considered positive, it's considered confirmed. So the term presumptive positive is out the door. Well, how do we flatten the curve? Will we be another Italy where people are dying right and left? You know what their decisions right now are? Who lives and who dies? Who gets to be on a respirator and who doesn't? That's a decision that they're making right now. Or we could be a South Korea. These people jumped on it from the very beginning. Testing, testing, testing. I hear that their test can be, the results can be found in a few minutes. It's amazing what they're doing. They're doing aggressive targeting social distancing. We're kind of getting there and kind of not. So what do? Test, test, test. If we have a positive, we need to then trace and test the contacts and have those people self-isolate. We need better communication between all our agencies, local, federal, state. Social distancing, we've talked about that. We need better protection for people like me and our nurses and our paramedics and our first responders. And we can start by getting more PPE, which we don't have. It's not in a big abundance right now, but I hear that's changing. The main thing is to stay calm, stay alert, but be ready. These are my sources, and so my intention was to inform you, not to foster more fear, but I always feel that if you understand something better, you can really work at it better. So with that, if council will allow me to take questions, I will do it.
Yes, Doctor. I know it's almost impossible to get any kind of handle, but what, based on everything you've seen, all these reports and whatever else, what is the duration that seems to have the most prevalent support in terms of how long we're likely to be with this virus?
The answer is nobody knows. And the reason why we don't know is because we have some obstacles. And the biggest obstacle right now is getting these testing kits out to everybody so that everybody can get tested. That's the biggest problem we have right now, and that we're already a few weeks behind. And like I told you before, we're not going to catch up. I can tell you that there are some people that have already canceled classes all the way through the entire year. So they're done for the year 2020. A lot of places are done for the year 2020. You have others that say it's going to be this summer. Nobody knows. It's all conjecture. Nobody knows. And I wish I had a better answer for you,
No.
but I'd be lying to you if I
Doctor,
told you
let me
otherwise.
Let me follow up with the question that is in serious debate in the city right now. You know, the county officials, Harris and Fort Bend, have handed down these edicts, if you will, saying shut down the restaurants, do these various different things. The things that I'm getting calls about, and some of them are rather frantic. They've been serving this, they've been paying sales tax, doing all this for 25 years. Now they're told to shut down. They've got people working in their establishments that very qualified, a lot of them are young, most of them making somewhere around the minimum wage or whatever else. All of a sudden they don't have a job. They have nowhere to turn. I talked to Congressman Al Green about it twice today and a couple of times before. And I talked to the Harris County judge about it 2 days ago. There's a concern here that everybody agrees, health is number one. We've got to do what it takes to control this. But since there are no parameters or no, if you will, somewhat agreed standards, everybody is basically in a state of limbo. And they're saying, what's going to happen to these people? Congressman Green promised me that he would get the word to the highest people in Washington. And I said, Congressman, remember, the ones that we're worried about are the ones that are most vulnerable. These are the people that don't have any money, can't do anything. Maybe the restaurant owner can hang on by his fingernails, but these people have nowhere to turn. So there is tremendous consternation in what we're going to be doing, what we're expected to enforce, and then what is going to be the situation with no determinable time limits or parameters on it. And I know what I'm asking you is, because I've heard everybody from Dr. Fossey on down to supposedly address this, but it's just a very, very scary situation. And in all of the ones they're bringing up with the stock market crash and the oil prices going down and all, we have not had anything like this that has been precipitated around a health emergency. And that is what's really got people very scary.
I think that for now, there needs to be some sort of a balance. I appreciate the economy part of it too. We're talking about people's livelihoods and people's jobs. And so I think that some of the initiatives for drive-through and takeout and all these things where people can still run their businesses, but yet not have to be in a restaurant or seated in places. I think that's, if we can keep people employed, my God, that's the best win-win scenario. I know that the White House is talking about some economic relief plans of some sort. I'm not sure where that's going, but if you look at South Korea, these people practiced aggressive, targeted social distancing. Everything shut down. Yes, was it an inconvenience? Yes. Did people lose jobs? I hope they're not, but they're not working. Then you have Italy, who basically sat around and did nothing. Everything, was, going on.
They're singing out the windows.
Yeah, they are. It's bad. And so this country has to make a decision as to where we're going. Are people going to be upset? Yes. Will they going to be inconvenienced? Yes. But people have to decide what their priorities are. And what I tell you today may be different what I tell you on Friday. Friday, the thing may be everything shuts down. I don't know. It all depends on what the data is showing us. So there's no right or wrong answer. It's going to be a problem for all of us. But we're all in this together.
Well, and I understand that. I want to personally commend you and thank you for what you've done Congressman Green this morning sent a letter that he was sending on to the Center for Disease Control, where we had this patient, the first one in Fort Bend Harris, actually the first one in Texas, I believe. And we've been trying to get, there was a presumed positive on him. We've been trying to get results back from the CDC. We still hadn't gotten it. He was working on that this morning for us.
Well, again, as the dictum today from CDC, all presumed positives are now positive confirmed. So Senator Green doesn't have to check. It's now official. That is a confirmed positive. Yeah.
If I can, two questions. One, as a city, what can we do for our first responders that we're not already doing? I know the fire department is very diligent in how they respond to the calls they get when they receive the call, but what about our police department? And two, how can we put out the word even more to make people aware of the presentation that you've given us? And
Well, first of all, I've been working behind the scenes with Larry DiCamillo, and so, and I know you don't see this, but there's been a lot of protocols and a lot of policies that we are being put in place over the past several days to hopefully mitigate a lot of these issues that we're going to have with our first responders. As far as the biggest problem right now is getting protective personal equipment, and that is not something that Stafford can take care of. We are at the mercy of the county, and the county is at the mercy of the state, and the state is at the mercy of the federal government, because they are the ones that have the national stockpile. We don't. And so our hands are, I don't want to say they're tied, but we're at their mercy. And until we get all that equipment, it's going to be very, very touch and go. We have some plans put in place to be very judicious about how we're using our resources. I won't go into those now, but believe you me, they're in place. But that's only going to go so far. And unless we get some equipment down here fast, it's going to be a major, major problem for our first responders.
so I understand that they were going to have some drive up or testing. Is Fort Bend County on the list, do you know, of having that?
I do not know. That is a county issue, and that's something that I would refer you to the director or even Judge George.
Okay, my final question is, you touched on it lightly about the telemed, I believe it is. How can people find out if their doctor is part of that?
The easiest way is just to call their office and find out. Some doctors are not set up for that.
Right.
I'm not set up for that. And there was a problem till now,
Yeah.
and now I'm thinking maybe I need to rethinking how I practice medicine. I'm going to tell you something. Life will never be the same as we know it ever again. Things are changing for everybody. From my field, your field, it will never be the same again. This is a historical moment. This is a turning point for our country, and it really depends on how we're going to handle it. And leaders like yourselves, it starts here. It starts at the ground level, because you're the ones that are making decisions for people that elected you and entrusted you with that responsibility. So this is serious stuff. It's real stuff. So I commend you all for doing your. I could not do your job. I could not do your job. I wouldn't
That's
want.
what I wanted. One thing I was going to say was thank you for this presentation. It was very well done. I feel like if someone gave me a test on the facts that you presented, I watched so much news, and since they turned off all of the sports, all I watch is the news now. So I feel like I've been well versed on these facts, and I really appreciate the clarity that you presented them to our community tonight.
I could go on for 3 hours.
I know you could.
Let me just say this, and Alice hasn't been here very long, and nor you, Don, but Dr. Joe has been with this city for what, 30 years, Doctor, I believe? Close to
35.
that? 35?
I'm old.
Well, so am I. But the thing of it is, he's been advising us for all these decades, not years, decades. And when he says the world has changed, and it'll never be the same. We need to listen to him because I'm totally in accord with what he just said.
This is our 9/11 again.
Sorry?
This is like 9/11 right now.
This is 9/11 on steroids.
Right,
This is
right.
this is bad.
The only thing I have to say, sir, I know that you are affiliated with other governmental agencies, and you said it right, we're 2 weeks behind. This kind of interface that you're doing with this council, that should have been across the board, all over the county. All over the county. And I know that there's other doctors that could have helped you facilitate this information and perpetuate it into the citizens of this county. That's what I'm looking at. And I was talking to Councilmember Virginia Rosas last week about that the county was behind on conveying this information you gave us to the population of this county that we're living in.
I'm gonna not comment
understand.
on that, but I think we all, it's been rough for everybody because this is something that's unknown to us.
Yes.
It's not like we're revisiting an issue and we just weren't awake and didn't snap. This is a day-by-day thing. This is uncharted ground, and nobody has the right answers for anything. And the other thing is that I hear politicians say something last week, and things have changed. Now they're holding those politicians to what they said, but what they don't realize is that what they said last week doesn't apply this week. It's not because they weren't telling the truth. It's because the situation has changed, and it's changing not by the day, but by the hour. By the hour. Yes, ma'am.
Alan?
Thank you so much for the information. Actually, I listened to many conferences for the past few weeks. I actually got a call from somebody I don't even know. The thing right now is like the test kits have a shortage, right? I mean, and then also they tell you if you actually have that symptom, you want to get a test, you need to go to a primary doctor. And the primary doctor, if they have the way to get hold of the CDC, then they get a test, right? But not every doctor has it.
Okay, so the way it works
Yeah,
is a lot of doctors like myself, we don't have the kits,
yeah,
okay? And that's part of the problem. So I cannot test my patients. Patients will call to a doctor, we've already been educated in our profession
Yeah.
to ask these series of questions. If they meet criteria,
yeah.
then they're referred either to an emergency room for testing or to the public health department.
Okay.
Because a lot of us don't have that testing. And who knows when we're gonna get it, if we're
Yeah.
even gonna get it.
Yeah.
We do tell our patients though, please do not show up to a doctor's office unannounced.
Yeah.
Do not show up to an emergency room unannounced.
Yes.
You have to let them know so that they can prepare for your arrival and give you instructions on how you need to show up.
Mm-hmm.
They'll tell you where you can get the mask and all this other stuff, and where you need to go into the hospital because they
Mm-hmm. You're
have
right.
designated spaces.
You're
So
right.
there is a process going on here.
Yeah.
My hope is that we'll have so much supply of tests that we don't have to worry about
Mm-hmm. I know,
criteria.
I know.
If you want a test, you should get the test. But right now, I had a patient of mine show up to a local emergency room, and they turned him away because they said he did not meet criteria. This man was sick. He was running a fever. He was coughing and sneezing. I don't know what criteria they were looking at, but they turned him away. Now, it's not because they're being mean. It's because they have so limited amount of kits that they literally have to decide who's going to get tested and who's not. And I hope the day comes when we don't have to be doing that.
Yeah.
If somebody wants to be tested, they should be tested.
But also concerned about some people, they don't have health insurance.
Right.
They don't know if they can go to get a doctor treatment because they worry about the medical expense too. They cannot afford this.
Yeah.
So how are we going to handle that?
That is going to be a issue for our public officials, probably at the national level. I know that that's already in the works about dealing with non-insured people, about how to get them care and stuff. So, you bring up an excellent question.
Thank you.
See.
Dr. Joe, I too want to thank you. It hadn't been 35 years, but it's been a long time since you've been here.
No, I've been in practice for 35 years.
Yeah, I know,
Yeah.
but it's
Yeah.
been a long time since
Yeah.
you've been
See,
here.
yeah, and I've known you where your hair was darker. What happened?
I knew you when you were tall.
Oh! I knew that was coming.
But I want to thank you for not only this presentation, but what you've done for this city and the employees of this city. Every time something comes up, well, we got to check with Dr. Joe. Well, that's what you're supposed to do. I mean, we've got everybody ingrained in that. So you've provided a tremendous service to this city and to the employees, and specifically what you've done with our first responders.
Thank you, I appreciate that.
And I think this will fit what many of the points you made about social distancing and staying home and washing your hands. And I forget where I saw that I've watched 100 of shows, and I think may have been a doctor said this. Our parents and our grandparents had to go to war, and many died in that war. We're asking you simply stay at home and social distance. And to me, that puts the whole thing into perspective. Yes, businesses are going to be closed, but we've got to get a handle on this, and compared to what our parents and grandparents had to do to save this country and this nation, it is a minor sacrifice on all of us to wash our hands, stay at home, and separate.
Many will suffer not only from a survival perspective, but also from an economic perspective. And I like what you said. I'm gonna have to steal that from you. But
we will get through this. I am
We're
absolutely
Americans.
convinced we will get through this, and I am so proud to be an American, to be in the state of Texas, and to be in the city of Stafford, because Stafford and Texas have done a lot of things that the rest of the nation never did and never can understand, period.
If people don't understand these viruses, right at the turn of the century, around 1916, I'm pretty sure Dr. Joe knows about it, there was 50 million people died of influenza. And they were during in the trenches of World War I.
yeah, that was 1918.
I was
Yeah.
2 years off.
Yeah, 50 million global, and a little over 500,000 Americans died. And the problem was the war.
Yeah.
Because unfortunately we didn't know what was going on, and a lot of our military were already infected before they got sent overseas.
Yeah.
And all they did was
Perpetuated.
spread the germs, that's what happened. And the problem was that the government knew that people were infected, but in a time of war, you don't want to tell your enemy what your shortcomings are, and so they did not. It was not publicized. And so that created even more problem. Instead of creating an awareness about a problem, they kind of, didn't talk about it, and then all hell broke loose. And then, to make matters worse, those people came back to this country,
And gave it
and
to our country.
that's when the problem started. Because when they left, a lot of them were already infected, but they were not ill.
Yeah.
It was when they came back that all hell broke loose. A lot of people died. Again, miscommunication.
Do we have additional questions or comments?
Doctor, I want to thank you for the wealth of information. And this is a matter of life and death. Don't take it easily. Take it seriously. Whatever the recommendation doctors like you are giving to the general public, it must be followed up. And that's what I am saying. So thank you so much.
Thank you. Thank you very much
All
for
right, thank you,
listening to my
Doctor.
talk.
We've got another item here to talk about Dr. Joe, if nobody minds. Item B, discussion resolution, City Council, City of Stafford, Texas, appointing Dr. Joe Anzaldua as the Health Authority for the City of Stafford for 20-22 and execute an agreement for health director services in the amount of $9,000 per year and an agreement for offline medical director services. Do we have any discussion on this from council?
Not at all.
Would someone like to,
I'll make that motion.
you make that motion? Now, we will be getting public comments on all this, okay? Item number C, discussion and ordinance, City of Stafford declaring a public health emergency, providing for a fine in an amount not to exceed $2,000 for each offense. Art, you want to address that one?
Yes, ma'am. What we're asking for,
Mayor, am I excused?
You're through.
Thank you.
You got your money. You got your money, doctor. You can run.
Thank you.
Thank you.